So let's face it, 2020 was definitely the year a lot of people picked up a habit of shopping online. It was out of a necessity somewhat, right? Buying groceries or ordering things off Amazon. Shopping became a whole lot easier for everyone. But just like with everything else, too much of anything can lead to serious problems. There's a new study that says compulsive shopping, buying disorder, is a real thing. Not only being able to control it not being able to control it rather could have devastating consequences. Here to talk about this is Dr. Erin Amato. She's a psychiatrist and the founder of the medical director of Montana Psychiatry and Brain Health Center. Look, this is a big deal, Dr. Amato. Thank you so much for being here. First of all, it is being recognized now as a disorder. We have to start there. That's really profound.
It is an exciting development, and this was an international body of experts and researchers that got together to define what the diagnostic criteria are going to be for compulsive buying shopping disorder. So it is important that this is finally being recognized as something serious enough to rise to the level of a disorder. And what's really exciting about it is this means that there is more opportunity to design good studies that are going to lead to more effective treatments.
And by the way, this is not a uniquely American thing. I mean, the fact that it's an international body recognizing it shows us that this is something that is global.
Absolutely, it certainly is, and it can have really devastating consequences. And I think it's important to make a distinction between impulse buying, which we all commonly do. If we go to the grocery store, we don't stick to our list, and we're picking up those items that they strategically place in the checkout line. But we're talking about compulsive shopping and buying that really rises to the level of often causing substantial debt. It can cause relationship problems, and it can also trigger a tremendous amount of feeling of guilt and shame and embarrassment and even hopelessness for people.
And look, we saw more of this increase over COVID because of people being isolated and shut in, and that was one thing we could do. And if you already have a tendency towards that kind of compulsive behavior, it could be exacerbated by the pandemic. What is it? You've had a chance to talk to some of these people who've been diagnosed, or you sense that they are either on the spectrum or leading to this. Why do people compulsively shop? What's behind it?
Well, there are a lot of similarities with compulsive shopping with other behavioral addictions, like even gambling or internet gaming disorder.
Sure.
And so often there are underlying problems with depression and anxiety that people are suffering from. And it may be that they are using the compulsive shopping or buying to escape from stressors or from really unpleasant or overwhelming emotions. And in this past year, there was plenty of that with boredom, anxiety, stress. And what we've seen is we have seen reports of alcohol abuse being on the rise in the past year. And I think in time we're going to see some actual statistics about the increases in compulsive shopping and buying and the consequences of those things.
You can get a shot of, look, I've scored something on sale or whatever, and you can get a shot of adrenaline, like a shot of dopamine from the rush that you get from a buy.
Yes, and that's why it's so tempting to engage in these behaviors to help escape from those unpleasant emotions, because with dopamine, which is one of the brain chemicals that's associated with the brain's reward system, you do get that little rush of dopamine that helps you feel good. But it is a temporary thing, and that's often then what leads to this cycle of guilt and shame and embarrassment when people are dealing with the consequences of that short-term relief.
Okay, so let's go to how do we know, right? How do we know that we're not just, as my girlfriend says, spendy, or, maybe you hide the purchases in the trunk of your car so your partner doesn't see? How do we know? How can we identify this is a problem? I need to address it, get help.
Right. So if you yourself feel like this is getting out of control and this is a problem and you need to cut back, but you can't, that is an indication that there's an issue going on. Or if you try to cut back and you notice an increase in feelings of irritability, agitation, anxiety, sadness, that would be an indication. But also going over some of those consequences we were talking about. If you have mounting debts and you are doing things like racking up the credit card bills, taking out new credit cards, refinancing the house, declaring bankruptcy, That's an indication that this is a problem. And again, the secrecy that can go along with this. If you are trying to intercept the credit card bills and you're hiding your purchases, going to lengths to cover up what's going on, that's an indication too. And if you clue into that you're doing this to try to escape from those unpleasant emotions or those mood states like anxiety or depression, think about getting some help.
Yeah, that mindfulness of knowing that if you reach for the credit card or reach for your Amazon cart, or then that could be the sign in those times of darkness. Okay, so let's say you checked off one or two of those things on your list, and you say, Houston, we have a problem here. What's the best step?
Well, I think first, just really internally trying to clue in to what are the emotions or the thoughts that you're having when you're sitting there, whether it's with your phone or your computer and you're looking at online purchasing, or maybe you're back in the stores, you're driving by the stores that you frequent. Think to yourself, why am I doing this? What am I feeling in this moment that I feel like I need to purchase this? And then go through questions like, how am I going to pay for this? Can it wait? And what are the consequences going to be? And then doing things like trying to distract yourself from the activity at the time.
Yeah, change your reality, right? Get outside or do something.
The environment. Shut down the computer, put your phone away, go for a walk, call a friend. Reaching out for support, having a friend or an accountability partner that you can check in on how you're doing with this can really be helpful. And there are groups out there too. There's one called Debtors Anonymous, where I think they're currently doing online or phone meetings where there may be some helpful strategies that you can learn from groups like that. And then there's always seeking professional help, seeing a therapist or a counselor, where there's no specific treatment necessarily for compulsive buying shopping disorder. But if you're really looking at those underlying issues with maybe anxiety or depression, there are therapies like CBT, cognitive behavioral therapy, that can be very, very helpful.
Look, and for those of you that might be in this struggle, like, honey, no shame, okay? Because we've all got something. We're all trying to this world, this life, it's tough. We all got something we got to deal with. And there's help out there for you. And as Erin mentioned, if you do know somebody who's struggling with debt because of this kind of overspending, overbuying, you can point them to get advice and help on this website right there on the screen, debtorsanonymous.org. That's the site that Erin mentioned just a moment ago. Dr. Erin Amato, thank you for this. It may say, oh, girl, I'm such a shopaholic. It can get to a dangerous level, and we want to make sure you're not getting yourself in trouble here. Thanks for having the conversation with us.
Thanks for having me.
Absolutely a delight.